Hello, my name is Brian Bobel, and I'm currently a physician assistant student at the Pennsylvania College of Technology in Williamsport, Pennsylvania. I am a first-generation college student and the son/grandson of immigrants that came directly to the USA from Uruguay, which is a small country in South America. The healthcare field always fascinated me, and I always had a drive to help people just like my mother, who happens to be a certified nursing assistant for populations with cerebral palsy. My inspiration my whole life, and the most brilliant woman I've ever met, was a woman that never surpassed an elementary school education. That person is Italia Cusati, or my Nonna. When my parents would be out working all day, trying to achieve the typical American dream, my grandparents, especially my Nonna, would watch over my sisters and I when we were kids. All 8 of us lived together in a 3-bedroom home for the first 18 years of my life. And having your sisters do your makeup at such a young age is quite the experience, I'll tell you. Italia was my best friend. We loved watching Wheel of Fortune, Caso Cerrado, making jokes, and of course, I loved eating all of the food that she would make me, and just messing up her hair and doing whatever it took to make her laugh. On my 25th birthday, we rushed my Nonna to the ER. She looked extremely ill. She was delirious, lethargic, and so I spent a majority of my 25th birthday with her in the ICU. Italia would go on to die 2 days later, July 28th, in that same ICU bed due to medical complications. My Nonna knew little to no English. She also was a chronic medical patient on over 10 different medications due to her having numerous medical issues, some being type 2 diabetes, hypertension, high cholesterol, cataracts, and Alzheimer's. Her past medical history included suffering from a stroke and a hip fracture, and that pretty much made her rely on a cane, which then transitioned to a walker, and then towards the point where she was unable to get out of bed without assistance for the last few years of her life, which was around the COVID-19 pandemic. During that time, I got to help take care of her since I was home more, and I got to appreciate my mother more in terms of what she did. My mother would work 7 a.m. to 11 p.m. because she is literally nuts and just wants to work all the time. And she would go to my Nonna's house at about 6 a.m. to change her, give a bed bath, change her diapers, etc. She would then go again after her shift, so this being like 11:30, midnight, do the same exact thing that she did in the morning, and then repeat. My grandfather lives with my grandmother, and he knew little to no English as well, so he was in charge of feeding her, but also giving her medications while having his own medical issues and having to figure out stuff in his non-native tongue here in America as well. Helping my grandmother at this time revealed a lot to me. Not only did we get closer, but it made me notice some things even in the healthcare field that I found disparities with, if you will. First, I noticed that some providers that saw her at home or at their offices made it seem like she was incompetent or some dumb person because she didn't speak the language. I also noticed that when I was the interpreter, or the middleman, people didn't even look at her and spoke only to me and only even looked at me, as if I was the patient and she wasn't even there with us anymore. I also noticed some providers seemed rushed or irked or a bit agitated because now my grandmother's taking up more time than they thought, and she's not understanding the question because she does take a while to comprehend, and on top of that there's a language barrier, and at that point I even felt uncomfortable as if I was a nuisance. It revealed to me really how hard it is to be a non-English speaking immigrant and try to seek something that should be fairly common and universal like healthcare. This idea made me question how other minorities or groups like the LGBTQ+ community or even those with disabilities, I wanted to know how they even felt in terms of receiving healthcare. So instead of just making this an idea, I decided to act upon it. I conducted numerous interviews with various people with various different backgrounds. I asked each person the same 3 questions. Question 1, I asked them to introduce themselves.
My name is Gabriel Valle. I'm a registered nurse in the Lehigh Valley, and I work in the cardiac ICU.
My name is Hamza. I'm a new grad, pharmacy grad. I am 100% Pakistani.
My name is Jorge Gonzalez. I am a junior. Everybody knows me as Jay, so I do go by Jay. I am Puerto Rican.
My name is Kevin J. Rizzo. My pronouns are he, him, his. My sexual orientation is gay, and My ethnicity, I am Ecuadorian, so I'm
Nice.
Hispanic Latino.
So my name is Robert Luna. I'm Hispanic, Native American. I go with he, him pronouns, and I am homosexual.
My name is Ronald Espinosa. I'm a nurse manager at NYU Langone Health. I'm Brazilian, Dominican, and Italian, and I am a gay man.
My name is Rosangel Del Rosario. Can you just call me Rosa? I'm actually a medical case manager. I work with caring communities. I deal with patients that are HIV positive. I was born and raised in the Dominican Republic and moved here in PA when I was 13 years old.
Josh was unfortunately unable to meet with me via Zoom because he does theater and unfortunately hurt his vocal cords and was told in order to properly restore them that he had to save his voice. So I will pop up his text logs here and you will see that I am reading his text that he sent to me verbatim. He says his name is Joshua Shepard. He is African American. He goes by the pronouns he/him, and he is gay.
Hello, my name is Dawn Dickey, and I have a lot of experience with having hearing loss. I'm the breeder. My hearing loss, and I've had that since birth. So I have a lifelong wide variety of experiences that I've had throughout my lifetime with my hearing loss. One of the things that I really wanted to kind of point out was my personal experiences has also led me into a career profession where I'm also helping individuals with disabilities. I work at college, University of Pennsylvania College of Technology in the Disability and Access Resources Office. And really it gives me an opportunity to use some of my lessons learned to relay resources and support onto students who have disabilities like myself.
My name is Aoife Fox. I identify as a pansexual woman and I use she/her pronouns.
Question 2. I asked them, have you ever felt uncomfortable, uneasy, or appalled by care you or someone you may have known received by a provider due to maybe personal preferences, their ethnicity, race, sexual preference, gender identity, disability, etc.?
I feel like technology has definitely helped with that, with like the iPad translator use. I do feel though there's still a lot of education, a lot of gaps of knowledge, which is not necessarily the provider's fault, but I feel like there is still a lot of education that can be done to help create a better patient experience.
Oftentimes, someone who's not a native English speaker, they come into the pharmacy and they might only know a couple words and they try their best to get their point across. If it's really busy or if they don't have like a lot of time to sort of help them, guide them through the whole process of getting a prescription filled or whatever, they might be a little neglected. Because we do have resources that we can utilize to overcome that language barrier. As far as like the ill will behind it, I don't know if, it's hard to say that language barrier, it's very significant.
My grandmothers are both born and raised in Puerto Rico. Their education level is very, very limited because they don't speak English at all. So going in and I could visually see like the doctor being frustrated. I understand there's a language barrier, but as far as professionalism, I feel like even if frustration comes up like that, you do have to be understanding. Like not everyone is, fortunate to have the same opportunities as everyone else.
Honestly, regarding my healthcare, the older generation, there's a lot of generational gaps. My current care physician, she is Argentinian and she's older, she speaks Spanish and all that stuff, so when I communicate with her, I speak in Spanish. I don't think it's more of a race issue, I think it's more of a sexuality issue. Beforehand, when I was a senior in college, I was class of 2018. Around that time, I was very concerned about my sexual health. I was very sexually active. And so I reached out to ask more information on PrEP. And so when I had called her to discuss about it, she seemed very unhappy on my request. She had essentially pretty much was just like, listen, if you are gay or if you are bisexual and you are engaging in sexual activities, I feel that you should go ahead and have this conversation with your parents. I was very upset and I told her, I'm just like, well, how could that be if you are my doctor and there's a doctor-patient confidentiality? Absolutely. And I've also self-insurance, health insurance specifically, so I know about HIPAA and like those requirements. And so like having that conversation with her, I was just like, listen, I'm already 21. I'm a senior in college. Why do my parents have to know any of that situation? Especially because at the time, like, I wasn't out to my parents. I was still trying to figure myself out. And so, like, to have a doctor kind of say that, like, we should talk to your parents on this type of decision, I'm just like, no, like, I don't really think so. Unfortunately, I had a mental breakdown about a few weeks ago. So I went ahead and I called the mental health clinic, and they told me, hey, we understand your concerns, but we do need a referral from your primary care physician.
Yeah.
I ended up going to the emergency room. They prescribed me Ativan to help with my panic attacks.
Yeah.
Now that I've gone to the ER, I can definitely get that referral to the mental health clinic. I explained to her, like, I went to the ER, like, I have the information sent over to you. And she was just like, I didn't get anything. I just can't write a prescription. And I'm just like, I understand that. Like, I'm not trying to fight you on it. I'm letting you know what's going on because, again, you are my primary care physician, and they're going to send you the information anyways, and I do need to follow up. So is there any way that I can at least schedule an appointment with you? And she definitely gave me rebuttal. She did not want to assist me in any way. So I was just like, okay, well, if I have to look for a new primary care physician, then I will do that. And she quickly hung up the phone.
My mother speaks mostly Spanish, and I've noticed that there seems to be a disconnect when she goes to the physician. I think Hispanic culture in the United States, a lot of times it's kind of just like seen as this kind of thing you can talk at, and they don't really have to understand maybe what you're saying. And so the patient will just kind of leave and not really understand why they're being given something or what their condition is. And I think a lot of times in Hispanic culture, they're afraid to ask questions.
But I can see, though, a lot of my friends in the community, healthcare doesn't seem to be like a part of their life. And a lot of them say it's because they're scared. Well, these are people who deal with a lot of things out in the street on like a day-to-day basis. So I think the last thing that they want is to go to a hospital or like a clinic or something and feel unsafe. I had a friend who wasn't feeling too well. I said, oh, why don't you go to your primary doctor? He told me he didn't have one. Thankfully in New York City, I mean, there's urgent cares all over the place. So I just told him to go to an urgent care. I mean, he's 27 years old, but he doesn't have someone to follow up with. Like, he's just, he went to the care, got his antibiotics, and that's pretty much it. Like, there's no one that's going to check on him. So that's real. I find that kind of interesting.
My mom has always talked about this. When they see a doctor, she feels like they're not very patient-centered. They kind of like tried just to focus on getting the point across. So like, okay, you have this health issue, or, give the patient a diagnosis, but they don't actually sit with the client and take the patient, and take their time to discuss what's really going on. 85-90% of my Spanish speaking clients, they don't know a lot about the HIV diagnosis. They know that they have what they have, and they know that they have to drink their medication, but that's about it. Like, okay, you've been dealing with this condition for, the years vary, but years, months. How come you don't know more about this compared to clients that speak English?
I have always had a fear of going to the doctor or seeing any physician when I was a child because of the stories and events I've witnessed. I'm grateful that society is beginning to see the institutionalized racism and police brutality, but there needs to be a spotlight for institutionalized racism in the medical field as well. I'll never forget how physicians would talk down to my grandmother and mother. It was very unprofessional. My grandmother and mother were nurses, so when a medical doctor would talk down to them like they didn't know what he, the medical doctor, was talking about, it felt completely uncalled for. For the Black experience, doctors called their patients difficult or uncooperative, when the reality is that history has shown how doctors and physicians have mistreated Black people since the times of slavery. From doing dangerous procedures/research without consent to terrible health care for minorities because of the lack of economic wealth in areas lived in Black communities and neighborhoods. Therefore, they can't afford better health care, nor can they get the resources for decent health care. This is a hard topic to bring up and talk about, but the injustice needs to be brought up if we want change. And I'm only talking about race, but I haven't even talked about what it's like for the LGBTQIA+ community or for religious groups.
When I communicate, it's really important that I'm having that direct one-on-one communication. When I'm in smaller groups, I do better. I'm able to follow along with communication. When I'm in a larger setting, auditorium style, it makes it a lot challenging for me to keep up with the communication that's happening. Who I'm interacting with can also be really challenging as well. You know, sometimes we have very strong accents, or sometimes facial hair, or maybe just the voice itself. It's hard for me to pick up on certain pitches of sound. So sometimes even one-on-one, I might struggle with interacting with someone. It's always been something, a habit of mine to, when I introduce myself to somebody for the first time, I always like to point out that I do have a hearing loss, and these are the strategies that I need to have effective communication. And when I share with the provider that I lip read and I depend on lip reading, it doesn't seem as he was very receptive to me needing to see him. And what he thought was just by raising his voice, that would help the situation, but it actually didn't. I'm really dependent on that lip reading. So I think, you know, that was something that was really, that caused that connection between the two of us to break down. It made me a little less comfortable to work with them, even after I've explained, you know, what it is that I need.
I was being treated for major depressive disorder and suicidal ideation at the Haven Mental Hospital in Reading. I didn't really have any issues with the nursing staff. I didn't have any issues with the tech partners. They were all very pleasant. They all respected me. When I went to see the psychiatrist, that's when things kind of started to turn. Despite my claims that I wasn't there on any issues related to gender dysphoria or my identity or anything like that, the therapist or the psychiatrist couldn't get over the idea that that was the reason why I was there. It had to be something about being trans. It had to be something about that. So he kept making points about how I came out a lot later than most trans people that he's seen, and he kept talking about how most trans people have their partners leave them after they come out, and not really like, I tried telling him my relationship dynamic. I tried talking about why I was actually there, which was actually for like work stress reasons. I was going through a rough time at work actually after coming out, and it kind of led to a little bit of a mental breakdown and going to the hospital to get help, and he didn't hear any of that. So all that he saw was a trans person who was there because of being a trans person.
Question 3. What would you want to tell providers or future providers on how to offer beneficial care that would make the provider-patient experience better, especially if you did feel uncomfortable because of something about your background or a preference that you did have?
I feel, the best way to compensate for that would be to have the knowledge base, use interpreters. I still feel like it's still a little bit of a gap there. It's hard to create that rapport when you're not from that native language. There's always, mannerisms that are different in every country, things like that, different cultural differences. You can't really compensate for that. I do feel though, as trying to have a translator there definitely helps with that.
The Google Translator, having the patient speak into the phone and having it being translated back to you, it's really easy to use, and it's pretty valuable. So that's something that you can utilize to directly combat that issue. It's the lack of education in general, which this disparity is a lot more prevalent in minorities, specifically Latin Americans and African Americans. If you look back in history with the Tuskegee trials and everything, historically African Americans and other minorities have always been sort of treated badly in medical environments. There's just this underlying fear where if they go to get help from the healthcare providers that everyone is supposed to trust in, that there's a chance that they might be harmed, or they might not receive good care because of the color of their skin. It is very important to treat your patient case by case. If it's a Jewish patient or a Muslim patient, to not prescribe them capsules because they contain gelatin, pork product. So you don't actually know how much of an impact you're going to have. Busyness is never an excuse for poor quality of care.
I would love to see future doctors or future people in the medical field, I guess just patience, and also having, at least an understanding of where people are coming from. And obviously, if you are frustrated, don't make it known, because it does make them feel bad.
Each race has they have a higher chance of getting a specific illness than the other one. And so I feel like that's definitely a factor. That's something that should be researched more. There just needs to be more education and more focus on not just like looking at the population as a whole, but different types of factors in it, such as socioeconomic status, race, sexuality, because I know that those different types of factors can also affect your mental health, but I really think it could also affect your physical health as well. And there's just not enough knowledge in that sense.
The provider needs to, number one, make sure that the patient is understanding what they're saying, like literally, like, do they know what the words mean? And a lot of, my mother was an immigrant. She, did not complete a lot of formal education, so it may take longer to explain those types of things. What is XYZ, what condition or what medicine, and providers need to take the time to teach their patients who may not have that formal education what exactly is going on, so they can make a more informed decision about their care.
I think visibility is important. Like, I know at NYU, almost every single person you look at, whether they're gay, straight, whatever, they might identify, every single person has like a little like LGBTQ like sticker on their ID. Being someone at a new place, that makes me feel super comfortable. Yeah. But I mean, being in a new space, with all different types of people, it makes me feel really good to see that everyone's an ally and everyone's so supportive. I think it's nice when you walk into an office or a hospital. I think NYU is a good example of that. You see people from all over the place. You see people who speak Russian, Croatian, people from, like the Latin countries. Like, there's people, one of my coworkers is from London. So I think it's super important just to have like a diverse work group and inclusion. I think it's just like, always do your best to kind of make people feel welcome.
Okay, treat the condition, but also try to make the patient feel relieved.
I would tell physicians and providers that religious beliefs has no place in treating a patient. Racism and xenophobia has no place in treating a patient. And homophobia and transphobia has no place in treating a patient. When a patient says that something doesn't feel right in their body, I want physicians to listen and not brush them off. I've seen that too many times, and then come to find out the patient was correct. I would tell physicians that no matter a patient's background, they need to be treated with respect.
When I think back on those negative experiences that I've had with one provider who simply thought talking louder was going to fix the communication barriers we have, I think it's important to really listen to what the preferred mode of communication is from your patient, and really being receptive to that, being supportive of that. Doing things a little differently than what you might be used to. But I think as a provider, you need to be flexible and willing to connect patients with where they are and what their needs are. So I think that part of it is really listening and figuring out what's best for that person. So strategies that work for me might not work for somebody else with a hearing loss. So I think it's really important to not assume, but to have that initial conversation as you're getting to know each other and understanding what the barriers are and what are the best methods to help them overcome those barriers. I think the other part would be, when I think about the masking, is really thinking about where are those situations that the mask is required versus what we could maybe do away with having a mask on. I had a dentist that I worked with pretty closely, and she never wore a mask with me. So I think as a provider, just being aware, knowledgeable of when you absolutely need to wear a mask versus maybe you could be in a situation or environment or create an environment that you don't need to use your mask. I had another provider who would sit me in a room and we talked through everything from beginning to end about a procedure. And then we would move into where he would put on his mask, and we had just visual cues that we would use with each other. So I think, even though in the moment you might need to wear a mask, can you provide any preliminary opportunity to really review information with that patient before you actually get into doing the procedure with them? So I think that's really helpful.
The biggest advice that I can really give is that we're just normal human beings. Even though we identify as different from the gender we were assigned at birth doesn't automatically make us always struggle with our appearance or how we present all the time. Not all family dynamics are negative. Not every partner is going to leave you because you come out. Not every family is going to reject you. Don't jump to conclusions, I guess, is what I'm trying to get at. Don't assume you know why a person is there just because of their identity or whatever else. Each person is dynamic and unique, regardless of their gender identity, regardless of the color of their skin. Everybody is an individual, and while one person may need treatment to help with a struggle with gender dysphoria, doesn't mean that every trans person is fighting it all the time. The entire point of transitioning is so that you don't have gender dysphoria and can actually experience gender euphoria. This was very much the case for me when I went into the mental hospital. At that time, I wasn't really thinking about my gender. I honestly rarely think about my gender. It's just me, it's just a way that I exist. I guess just listen and actually hear people when they talk. You're in a position where you can change a lot of people's lives. You can make such a difference in the life for so many people from such extraordinarily disparate walks of life. Strive for all your interactions to be positive, and strive to be a source of kindness in all your patients' lives, especially within a mental health setting, because these people are seeing you for a reason. They want and need help, and you have the ability to do that. But with that ability, you also have the ability to make them scared to ever see a healthcare provider again. We are not a case study. We're not a debate. We're not some sexually deviant fringe that you don't have any way to relate to or have anything in common with. We have hopes and dreams, and we have fears and anxiety. We're just like you. We deserve the respect and kindness owed to all life. Be a beacon of light and hope for all the patients you see. You will know you succeeded when you see the relief in your patients' eyes, when they know that you're actually hearing them, hearing their problems, and trying to fix them.
After doing this project, I realized the healthcare field isn't perfect and has flaws of its own. The median length of visits with a provider is about 15.7 minutes, with patients speaking approximately only 5 of those total minutes. So imagine being non-English speaking or utilizing American Sign Language or ASL. In terms of race or color, Black and Hispanic people are 3.57 times more likely to die from COVID-19 and are 1.8 times more likely to have higher blood pressure as compared to white people. A 2016 study also showed that a majority of white medical students believe that Black people have higher pain tolerance than white people, and this myth made those in that study less likely to prescribe pain medications to Black people for that myth alone. We also need to stop having biases and limit people with disabilities as handicapped or helpless. In June 2020, at a Texas hospital, a severely disabled man named Michael Hickson was denied treatment for a UTI, sepsis, pneumonia, and COVID-19. On literal audio recording, Michael's physician, without hesitation, denied him treatment because he believed that all life-sustaining treatment should be kept for those who have actual quality of life, he said, and those that can walk and talk. Michael would go on to die 6 days later. The LGBTQ+ community has problems at healthcare facilities frequently due to mislabeling, misgendering, physicians refusing to see a patient because of having a personal disparity between a patient's actual sex or perceived sexual orientation. They have anxiety due to seeing a provider that may discriminate against them, and much, much more. My answer to this problem is what everyone I interviewed said: respect everyone. Leave all your biases and prejudices at the door. Ask for their pronouns, their preferred names, and how they identify. Don't judge someone who comes to you vulnerable for care because of a disability they may have or a potential language barrier. We are in healthcare. Our jobs involve the act of us caring for other people. We are fortunate enough to have higher levels of education that many people, such as my Nonna, would have killed to have. Do not treat people that don't speak English or have a higher level of education as dumb or they are inferior because you're in a rush and you need to know how to treat them and they need to get out of your face. At the end of the day, we are all equals. We are all human beings. My Nonna would always tell me in Spanish, "No te pierdas," when I would leave after visiting her. That translates to, "Don't get lost" in English. As I mourn her death to this day, I realize that us as healthcare providers can't get lost in our own biases. Take the time to get to know your patient. Don't believe myths such as Black people lie about their pain levels or that someone can't identify as they choose. Understand and be patient if they don't speak English. So it's okay to utilize an interpreter. It's okay to spend a little more time trying to understand what they're saying. Or if you evaluate someone with a disability that requires additional aids, it's okay. Make them feel comfortable. Build that rapport. Be that provider. Ask for their preferred pronouns. And if they disclose that with you, or they say that they're gay or transgender, don't make them uncomfortable because you're uncomfortable. Everyone deserves respect and sufficient health care. We are all humans. Everyone gets into any profession because of a why. My why was a tiny woman that dropped out of the 3rd grade and moved to the USA where she didn't know any English and worked non-stop to provide a home for her grandchildren in hopes they one day would receive a quality education and impact the world in some way. She was the strongest and most resilient woman I've ever met. Atalia Kusati is now and forever my why. I ask that if you watch this, hopefully this video can inspire you. Don't fall into biases. Don't fall into lackluster patient care if you're a provider. Stand up for what you believe in, especially when it comes to being your very best in whatever field you are in. I ask, if you do watch this video and you enjoy it, and the message, I guess, resonates with you in some way, share it. Share this video. Use the hashtag WHYICARE and say why you chose to get into that field. The field that you are in now and how you plan on making a difference, whether that be in your community, your workplace, at home, anywhere. As the late Robin Williams said in the movie Patch Adams, you treat a disease, you win, you lose. You treat a person, I guarantee you'll win, no matter what the outcome is. Thank you.